جديد. Good morning everyone. We have a new guest منورنا فشكله بردان فنحطه بالهوت شير حتى يدفى. يلا كم لا تعرفين Don't say I don't know. You know. So this is the mouse and this is a 74-year-old female patient presented with abdominal distension, abnormal ultrasound, so MRI was recommended. Take the
Abdominal distension for how many days?
long duration abdominal distension. First of all, what is this sequence?
This one is corona.
This is sequence, not plain. شو يسموه هذا؟ هذا localizer. يعني هذا not used for diagnostic purposes. Okay, you are just second, so we'll start easy. This is called localizer. That's just for localization, not for diagnosis. So now we will start with the first sequence, which is what? Let's see this one. What is this? T1 or T2? ليش? Why?
Yes, the spinal.
You have a wide CSF, so this is T2. Fat saturated or not fat saturated?
Not fat saturated.
No, it is fat saturated. هذا الفات شوفي it's black. Axial, coronal or sagittal? الفلاش مالتك معلوم. Okay? Axial. زين يلا scroll and describe what you see. It's a very easy case, just يعني up to your level خلينا نقول. يعني nothing ما أدري which weird syndrome, straightforward. What do you see? Tell me.
They are helping me.
I know they are helping you, but you don't need their help. You need my help. So, just describe what do you see. See, you're a female. You have a natural born talent to describe. انتو من اروح ويا مرتي للمول اني اشوف female. She sees female wearing this, doing that. She's long, she's fat, she's I don't know what color her shoes are. It's built in, natural. So just describe what you see. That's it. You have advantage here.
Yeah, well-defined
Mm-hmm.
cystic lesion.
Well-defined cystic. Why you said cystic?
It's taking the enhancement. Sorry,
Mm.
it's hyper.
It's hyperintense on T2. It's well-defined. So it's cystic lesion.
Inside the liver, right?
Inside the liver. Where's the liver?
This one.
Okay, so is this inside or outside?
As far as I see, it's inside the liver.
First of all, you only saw one sequence. You have a lot of sequences. You can use other sequences to confirm or exclude. So don't hurry to jump to the diagnosis. So first of all, it's a cystic something, large, well defined. Okay, what's the sequence? Coronal, axial, or sagittal?
Corona.
Coronal. T1 or T2?
T1.
قلتي هذا cystic. This is T2. Fat saturated or non-fat saturated? Don't look here. This is poor at the edge of the image. You go for the center of the image, which is dark, fat saturated. So this is the lesion. Is it in the liver or outside the liver?
Outside the liver.
لا ليش قلتي in the liver? See? So it is outside the liver. Where is it located? Let's go to another sequence. What's this sequence?
Axial.
Axial, T2, fat or non-fat saturated?
Not fat saturated.
Good, excellent. شوفي هسه بدينا نحمل. زين. Where is this located? Huh?
It's intestine.
It's within the mesenteric fat planes, okay? So, what's the, let's say, distinguishing feature about the cyst? What's, something, when you see a cyst, is it unilocular or multilocular usually? Like simple renal cyst, unilocular or multilocular? Simple renal cyst,
Simple unilocular.
unilocular. Is this uni or multilocular?
Multi.
Multilocular. It's septated. It's septated, okay? So, the surrounding fat planes, let's go back to the T2 fat cell. The surrounding fat planes, they are clear or dirty? Stranded, edematous? Huh? Clear. Good. Does it look to have soft tissue component or not? No soft tissue component. Does it look to invade, encase, destroy anything? No. Okay. So, let's see on the T1, just to make sure that our description is, this is T1, non-fat saturated. Okay? So, anything changed in our description? Nothing changed. So, what's your diagnosis or differential diagnosis?
You said mesenteric cyst.
I said it is within the mesentery. I didn't say mesenteric cyst.
Mesenteric cyst.
Mesenteric cyst is a possibility. By the way, let's see the post-contrast images, just to be. This is post-contrast. Does it enhance? No, there is no enhancement. Yeah, kinda mild in the septi. Let's compare with the pre-contrast. This is contrast. Sorry, where is the pre-contrast? What's going on? This is the pre-contrast. It does not look like enhancement. There is some signal in the septi before and after. So, first of all, mesenteric cyst. What else? You are living in the Middle East. Keep in mind, common is common, rare is rare. كلكم واحد راح تقومون. واحد. بسيط. طلعت عضلاتكم على السكند؟
لا والله خطية يعني.
اي ادري خطيه. Hydatid. What's against hydatid? What's with hydatid? Why you said hydatid? ما لي علاقه بهم. So why it's hydatid?
As we said, it's common in our.
It's common. First, second. When you see an ultrasound, you have a hydatid cyst. What are the criteria that you look for? Ultrasound. أو في التركي الأمر.
For the daughter cyst?
There is a daughter cyst. Does hydatid take contrast enhancement?
No, not
Usually the enhancement will be only in the where? In the periphery. Is it in the cyst or
outside.
it's the fibrous capsule? Okay? Keep quiet please. النشاط صاعد عندكم من الصبح ما ادري ايش ماكلين. زين؟ مو؟ So, the enhancement will be in the fibrous capsule. Fibrous capsule belongs to human body, not to the cyst. Okay? Does it have any soft tissue component? No soft tissue component. So, probably this is a hydatid cyst. Okay? And is it the common location for hydatid cyst? This? It's not very common. Where is the common location of a hydatid cyst?
Inside the liver.
Usually hepatic or lung. More common. Is there any place that hydatid cyst does not happen in? Like never? Hydatid cyst can happen everywhere except three spots, three places. Hair, nail, and cornea.
Hair, nail, and what?
Cornea.
Cornea.
Why? Because they are avascular. There is no blood in the hair or in the nail or in the cornea, so the scoliosis will not reach. Otherwise, it happens everywhere. Okay? Good job. Thank you very much. Hydatid مو؟ بسيطة بسيطة.
هاي
Mesenteric. Mesenteric hydatid. So would you drain that? Would you do an aspiration for that? You will?
Aspiration.
Aspiration for this? No, no.
Why?
Because of rupture and the daughter's
The patient will go into anaphylactic shock and you'll have innumerable cysts everywhere. It will be worse than cancer.
يعني operation ما يسوي operation.
Surgery إيه.
Surgery.
Drain aspiration, no.
Yes.
With surgery, what they do, first they put a needle, طبعا open the skin, put a needle, they inject some alcohol and wait for a few minutes. The scoliosis will die. Then they aspirate. أخاف لا يصير spillage or rupture. زين. Nice. 4, 3, 1. أنا ما قلت زين، قلت nice. 4, 3, 1. I remember this case. It was so interesting. Well, this is a 28-year-old female patient. She came with her husband. Her husband was like small guy. شلون ميرا مثلا هيك يعني okay. هي normal size يعني not big. Anyway, her eye blue, swollen, closed. Her doctor said trauma. Okay. Unfortunately, that day my CT scan was not working, so I shifted her to MRI. This is the complete story. Okay? What's the sequence? Good. Now, again, localizer. Again, localizer.
MRI of the brain and section.
Is it of the brain? Of the brain, you should see the brain till the head.
Head and neck.
Of the brain, you should see the head to the brain. Sorry, you should see the brain to its end.
Yes.
Is that the brain to the end?
No.
No, we are not here, and that's it. Stop. So this is an MRI of what?
Of the orbit.
Of orbit, exactly. And given the clinical history,
Yes.
it's of orbit. So,
The right
is it
eye.
axial, coronal, or sagittal?
Axial.
T1, T2, or fat sat, or what?
T1.
T1?
Without fats.
Without fat sat. Good. We are going somewhere. First of all, what catches your eye? The first thing
The
here.
right eye or يعني the right.
The right what? Right what?
The right eye.
Mm-hmm. شبيه?
The right orbit.
Right orbit. شبيه? What's going
There
on?
is abnormal signal intensity.
Nice. First of all, let's start inferiorly. Is this normal?
Sorry.
Is this normal?
There is a fluid density inside the right
Fluid
maxillary.
intensity. And is this fluid intensity? Is the fluid hyperintense on T1?
No.
So what's this?
Fat. Maybe fat.
Maybe
blood,
fat or
maybe
blood. Good. Here ممكن it can be fluid.
Soft tissue.
Okay. So, here first. Let's go to another sequence. In orbit, you usually prefer what? Axial or coronal or sagittal?
Corona.
Coronal. So let's go to coronal. This is coronal, T1, low T2, low T3, low T4, low T5.
This is corona T2
Mhm.
without fat cell.
Good.
Showing
Showing.
the right maxillary sinus
Mhm.
also contain high intensity
Mhm.
with a soft tissue component.
With a hypointense component. هاي الهايبوintense هي نفسها اللي كانت hyperintense بال T1. Yeah, it's the same that was hyperintense on T1. So what's hyperintense on T1 and hypointense on T2?
Fat, blood.
Blood.
Yes.
Good.
Hematoma.
So this is hemosinus.
Yes.
Hi first. What else?
There is also a high abnormal signal.
Good.
On the medial side of the orbit.
Good. What else?
With hypertrophy of the muscles.
Hypertrophy of the muscles, okay. So, can you like connect the findings together? What does it mean? يعني? You have hypertrophy muscle according to your.
But I want to see the optic nerve.
Look for it. Okay, see it. We have other. Now you are going to. Just a second. Give me a second. This is coronal, T1. What's this? This is axial, T2. Yeah. First of all, before we continue, why this image half down, half up? What's that?
Wrapping artifact.
Good, wrapping artifact or fold over artifact. And how do you solve that?
Field of view.
You increase the field of view. هذا نفسه بالضبط بالدوبلر شو اسمه الاليزنج. هو نفس الشيء الاليزنج مال الدوبلر هو نفس هذا الاليزنج بالام ار اي. When it's a small fold of view you have wrap over. Okay, so sometimes it happens. So wait, don't. Let's do this one. See, big field of view, no wrap around the artifact. Yeah, Rawini, what do you see?
There's a hematoma inside the right.
Blood
macular
fluid
sinus.
level. Yeah, okay. What
So
about?
abnormal signal intensity around the medial rectus muscle.
Good.
The optic nerve. Looks normal.
Mm-hmm. So,
The lens intact. يعني the vitreous fluid is clear.
good. So, what's your impression?
Contrast. Take a contrast. No.
No need.
Maybe this hematoma causing pressure effect on the eyeball.
Okay,
Make يعني causing proptosis.
maybe.
Some. It's not gliosis.
Gliosis?
يعني مو gliosis.
جاب gliosis بالاوربت يعني.
تروما يعني. هذا تروما على كتاب.
زين.
sometime اللي عندهم
ميران ضارو.
شو اسمه يعني causes of proptosis اكو مثلا gravis وهاي هذول اللي عندهم
So,
hyperparathyroidism.
wait. Leave the mouse, please. Let's do like this. Just wait. Just give me a second.
High signal inside the ethmoid sinuses. Also.
Wait. Let me do this heart window. Now, what do you think of the retroorbital fat? Compare.
There's high intensity.
It's diffusely edematous
Yes.
of the retroorbital fat. Okay. Now,
extra maxillary
wait. Don't hurry. لا تستعجلين على رزقك. ترى عندنا كيسات خير من الله. بعدين يجيك الدور تخاف بردانه شيء تقعدين على الهوت شير. زين. What's the most important thing that you missed? لا تحركين كل شيء on this image. هذه here there is something. If I write it, she will go into surgery immediately.
Ethmoid air sinuses.
الإثمويد opacified بعد. What's the emergency about that? We see ethmoid opacification every day. The most important thing is to mention the relationship of the inferior rectus and the medial rectus to the sinus. So where's the inferior rectus? اشري لي عليه Okay. Is it herniating into the sinus or not?
Yes.
Good. What is the medial rectus? Is it herniating into the ethmoidal cells or not?
No. I don't see herniation.
Compare with the other side. herniating لو لا؟
يعني المنطقة كلها أوديماتس مع
اديماتس يعني انا بديماتس هذا نفاتسات اصلا ما دا اشوف الاديمه اني. Compare with this side with this side.
intact يعني.
Okay. Let's like here.
Yes.
Herniating or not?
Yes, herniation.
Good. So we have herniation indicating fracture of where? أنا ما عندي CT scan قلت لك كان عاطل التيوب احترق. The tube was burned and it cost me like $16,000. So anyway, I was really angry at that.
The base of the orbit يعني.
Fracture, floor of the orbit
Yes.
and هسه طلع لسانكم قبل شوي كلها ساكت.
Lamina.
And lamina papyrus. Okay. So fracture of the floor of the orbit and lamina papyrus يسمون what's called
blow up.
كي يسمون؟
بيقولوا
ايش عليش تبيهم انت احكي لي.
blow out fracture.
blow out fracture. Okay. blow out fracture. فمن انا عندي هاي الكيس blow out fracture. What should I ask?
History of trauma.
Mechanism of injury. مو مسترف تروما it is تروما لو تنقلب السمع على القاع تروما. اوكي. الما نسال ميران. اوكي. ميران how did she got injured and what did he say?
Box.
هو قال لي he said I just gave her a box in her orbit and ended up with fracturing her orbit completely. okay. وهي جايه وياه عادي ولا كانه ولا رايحين سفره يعني. زين. and he was worried will she need surgery at least pay for it يعني at least يعني you fractured you blow out her orbit at least pay for it. تمام. So this is an orbital blowout fracture with hemosinus and herniation of the inferior rectus and the medial rectus into the sinuses. Okay. And it's an emergency for surgery since there is muscle herniation. They go from the sinus, they push the muscle up and close the defect. هلا بوجهك تمام. good. لا اليوم عندنا سينيور ثاني خو ما كل مره انت كل اسبوع خطيه هي يعني. امنت يلا. زين خلينا نشوف. let's see something that is لا مو difficult مو قصة difficult قصة to the level of the
سينيور حساب.
بالضبط. 407. زين. let's go to number 407. 4 وينه دقيقة لحظة. ايه 407. This case of a 20-year-old male patient presented with long-standing swelling in the around the knee joint, and it is recently starting to increase in size with a little bit pain. هذا الفول history. So MRI was requested. It's not difficult, but need a little bit of attention. It's not very rare or something.
No history of trauma.
No trauma.
MRI of the knee.
Good.
Sagittal proton density fat cell.
Nice. كنت انتظر تقولي انت تو فاتسات حتى اقول لك لا هاي بروتون دنسيتي. اكسلنت.
ACL impact. ACL. Upcoming ACL.
Since we don't have much time, just go to the coronal. Let's see the, go to the money. Good.
هاي شوي صار
What?
هاي شوي أصعد المرض.
أربع إشارات.
يعني قصدك شو اسمه؟ Wait a second. Just a second. Wait. Yeah.
medial collateral. There is fluid signal intensity inside the
Shanga. I'm getting hot. بدي أقول لك no trauma, nothing. عوف الليجامنت والمنسكس والكذا.
There is abnormal signal.
الحمد لله. أول شيء there is abnormal signal in the meniscus, in the condyle, femoral condyle. أوكي. زين. شوفي إن هاي السيجنال إيش بيها، شلونها، منيلها.
Also, يعني extending to the metathesis.
When you have an image, you need to scroll all through from beginning to end.
There is abnormal.
There is abnormal.
There is no define. It's oval shaped fluid, high signal intensity lesion seen in the adjacent to the lateral aspect of the thigh of the femur.
So there is fluid signal intensity seen adjacent to the lateral aspect of the femur. Heterogeneous.
Mostly.
زين. What do you think this is? First of all, احنا متفقين انه when we said the 1,000 time, when you have a musculoskeletal MRI or CT, first you ask for an X-ray. You didn't ask for an X-ray. That's one against you. I don't have an X-ray. But you should ask. لازم. Every musculoskeletal CT or MRI. And if you are in a clinic or in a hospital or كذا, if you don't have an X-ray, the patient doesn't have an X-ray, go do an X-ray for him. Don't report it without an X-ray.
But I think outside the bone.
Okay. To have a better idea, you need other sequence. You have a lot of sequence, just go for it. No, go to the axial. بس لو تبطلون تتبسبسون. هذا شنو؟ هذا with contrast. T1 with contrast, fast saturated. بعد وقت عليه. خلينا wait. خلينا بالاكزيال. Yeah. هذا T يعني proton density fast saturated. ها.
Extending from the medulla of يعني the lesion is in contact with the bone.
Good.
And if the medulla of the bone is adjacent.
Continuous with the medullary cavity of the bone.
Of the lesion.
Good. So,
يعني
osteochondroma or exostosis.
Yes. But
So,
the cartilage
yeah.
is very thick.
That's the most important thing.
Yes.
There is a thick cartilaginous cup. If it is more than,
1.5.
okay,
Risk of osteo.
if it's more than 15 millimeter or 1.5 centimeter, it's a high risk for chondrosarcoma. So what should I do in this case?
First search for another يعني if it is multiple osteochondroma.
Okay, we can look for other osteochondromas or exostosis.
And compare with the previous.
Compare with the previous, excellent.
And
Patient in the machine now. What should I do? Give contrast. شوفي لنا الكونتراست. ها T1 axial قاعدو مكتوب. Yeah. No. اوكي هو هذا كونتراست بس no problem.
and
الاكزيال is better I think. So what do you think?
enhancing with irregularity
Mm.
is very يعني suspicious for osteochondral أو chondrosarcoma.
Chondrosar. And if we link it with the clinical history of an swelling that is starting to enlarge,
Yes.
بالبداية قلت لك starting to enlarge and getting little bit painful, it's very suggestive of malignant transformation of osteochondroma into chondrosarcoma. Okay, so you have to keep that in mind.
Yes.
Not only osteochondroma, روح, they will put him on follow up until he is metastatic. They have to go and take it immediately. Okay?
Can you show us the cartilage cup?
Cartilage cup هذا. Just أعطيني. This is the cartilaginous cup. Okay, if you just a second, let's go. Let's see it here. شوفي ال areas of enhancement. I don't think we have. My technician didn't do pre-contrast image for the. But anyway, you can see easily that this is hyper intense. It's cartilage, okay? And if we go to the axial T2 fat sat or proton density يعني, you can see easily if we measure it here that this is around 15 or 16 millimeter, something like that, and you can see the edema of the surrounding soft tissue indicating some active process here. Okay, if this was not thick, just osteochondroma and leave it or remove it, whatever you like. But this edema and this thick cartilaginous cap with the enhancement, foci of enhancement, some enhancement of the overlying soft tissue is very worrying. Okay, even it's little bit displacing the patella to the other side. Okay, زين. ليلى. هي thank you. Final ختامها مسك احنا نقول. What's this line? This white line here. What is it? Artifact. Which kind of artifact? يعني شنو الجهاز مالتي مو زين قصدك؟ You're talking about my machine, this is my baby. Movement of the patient. If I have movement of the patient, all the image will be blurry. Not I have a white line. What's this artifact? طبعا هاي المفروض تنقصها first يعني شغلها.
بس أنا ما قاعد.
نجيب والله احتار انا وياكم ليه ما نجيبها تشوفون. ايه ما طلعت كيس.
لا خلص الوقت.
This is what? This artery pulsation artifact popliteal artery. You can see this. Here's the artery flow void, and since it's pulsating, you can see it's all over from beginning to end. Okay, due to arterial pulsation. Okay, so keep in mind you have this kind of pulsation artifact. Okay, thank you. See you next week. Hello.